This journey that Jean's been on fighting this cancer has clearly had a huge impact. I mean, you don't go by a single day without thinking about it. And certainly the medical trips, the clinical trials, the surgeries, the recoveries, trying to worry about the kids and their care while she's off on these visits is first and foremost in your mind. I stay hopeful, I guess, first of all, because Jean stays hopeful. I mean, her courage and strength and determination is unbelievable. I think I would have given up long ago when I've seen some of the things that she's had to endure. But she doesn't, and she remains committed to her wellness. So that is very, very inspirational. The other thing that helps me with my hope is I've gotten to know many of her caregivers very well, and several organizations that have been created to help people with these rare types of cancers. And there's some exceptional people. I mean, they really do care about the patients, and not just the diagnosis, they care about the whole person. They become good friends, and I know that they're working extremely hard. Being the husband of a cancer patient, first of all, I'm not unique, but it's interesting because his friends have had family members approach a diagnosis. I try to reach out to them and share with them what my experiences are. I don't know all the answers, but clearly when you've been through something like this, you do gain some tricks to persevere. And I think the first thing is you have to clear the decks and prioritize the medical appointments, the treatment options, and come up with a game plan for the wellness of your family member. If you have kids like we do, you've got to make sure that they're taken care of as you're off on this journey. As a caregiver, I think it's extremely important that you go to the visits and listen. As doctors would talk to Jean about what's happening and what the options are, as the patient, she would hear a negative and latch onto that. Even though she's a positive person, it's very scary to hear the word complication, or your liver enzymes are elevated, or you've broken through this therapy, when in fact, the whole visit may have a much more positive spin than that one phrase. But as the patient, which I'm very empathetic to, you're going to lock on to that negative comment. As a caregiver, you can absorb it all. You're not the patient. And then as we debrief after the visits, I could kind of bring Jean back to a more solid footing of what we actually learned, which in most cases was better than what maybe her impression was. So we got to know a lot of these physicians just by going through the research for her own care. And we learned that all of them were just wonderful people, and they all had a little bit of different angle on the disease. And they knew their other colleagues at different medical centers, but they didn't really get to know them very well. So the concept was, let's bring these professionals together. Let's get them out of their silos of the academic centers, put them in the same room, and get them to know each other so they feel comfortable sharing. Jean has the energy of 150% of a normal person, which is very exhausting as her husband. But the disease definitely has brought that down, but she's still got the energy more than most normal people do. So obviously the hope is that we'll be able to hang in there long enough. We also know that she's in a higher risk category. She has metastases on her lung, liver, and bones. That's a stage 4 cancer. And she's broken through one clinical trial already. But, you know, like Jean, getting the inspiration for her, nobody's giving up. And the physicians we work with, they don't give up. They email her, they call her, they care deeply about Jean being well. And I think that's part of Jean's genius. I mean, she is infectious with her passion for life, and I think the doctors just love to see her. Even if it's difficult news, you know, they really want her to do well. So I feel that, you know, we're going to continue to do well.